Most people who go to the hospital don't expect to cause a mass emergency just by showing up. But on the night of February 19, 1994, a 31-year-old woman named Gloria Ramirez did exactly that. She arrived at Riverside General Hospital in California, suffering from what looked like advanced effects of cervical cancer. She was weak, disoriented, and struggling to breathe. Paramedics said her heart was beating too fast, and she was in serious distress. Standard procedure: get her stable, draw blood, administer medications. But the moment the staff began working on her, things took a bizarre and terrifying turn. One nurse inserted a catheter and immediately noticed a strange, oily sheen coating Gloria's skin. Another nurse said she smelled a sharp, fruity odor coming from her mouth, like garlic or rotten fruit, mixed with a harsh chemical bite. When they drew blood from her arm, the ER staff reported that most people who go to the hospital don't expect to cause a mass emergency just by showing up. But on the night of February 19, 1994, a 31-year-old woman named Gloria Ramirez did exactly that. She arrived at Riverside General Hospital in California, suffering from what looked like advanced effects of cervical cancer. She was weak, disoriented, and struggling to breathe. Paramedics said her heart was beating too fast and she was in serious distress. Standard procedure: get her stable, draw blood, administer medications. But the moment the staff began working on her, things took a bizarre and terrifying turn. One nurse inserted a catheter and immediately noticed a strange, oily sheen coating Gloria's skin. Another nurse said she smelled a sharp, fruity odor coming from her mouth, like garlic or rotten fruit, mixed with a harsh chemical bite. When they drew blood from her arm, the ER staff reported that the syringe filled with blood that smelled strongly of ammonia. And inside the blood, they saw strange manila-colored particles floating. That was when the first person collapsed. It started with a nurse who suddenly slumped over, fainting on the floor. Then a doctor began swaying and had to sit down. Another staff member staggered out of the trauma room and collapsed. Within minutes, the ER was in chaos, not because of Gloria's condition, but because the people trying to save her were dropping like dominoes. In total, 23 people became sick. 5 were hospitalized. One nurse was in intensive care for over 2 weeks. Some had trouble breathing, others were vomiting. One had tremors and convulsions that lasted days. The ER was evacuated. Patients were moved to other rooms. Doctors were forced to treat Gloria while wearing hazmat suits. But despite their efforts, she went into cardiac arrest and died 45 minutes after arriving. The cause of her death was listed as kidney failure related to her cancer, but no one could explain what had just happened. What kind of person causes a toxic event in a hospital? And more importantly, how? A syringe filled with blood that smelled strongly of ammonia. And inside the blood, they saw strange manila-colored particles floating. That was when the first person collapsed. At first, investigators thought maybe it was a chemical spill or a gas leak, but nothing turned up. The hazmat team found no trace of any toxins in the ER. No nerve gas, no chlorine, nothing in the air vents, nothing on the walls. Her clothes were sealed in biohazard bags. Everything was tested, and everything came back clean. That's when the theory started. Some said mass hysteria, panic attacks spreading from one staff member to another. But that didn't make sense. You can't hallucinate ammonia-smelling blood or floating crystals in a syringe. And you definitely can't fake collapsing, convulsing, or being hospitalized for weeks. So what really happened in that room? The most widely accepted theory, and it's still just a theory, is that Gloria may have accidentally created a chemical weapon inside her own body. Some scientists believe that she used a compound called dimethyl sulfoxide, or DMSO, as a homemade pain reliever. It's a solvent that can be used as a topical cream, and in the 1960s, it was popular for joint pain. But it was banned for medical use in the US after it was found to cause eye damage and other side effects. Despite that, many people continued using it, buying it online or in hardware stores. It smells like garlic and can leave an oily residue on the skin, just like the nurses described. And here's where it gets strange. Under certain conditions, like oxygen being administered, DMSO can convert into another compound called dimethyl sulfate. That's a highly toxic chemical. It can cause convulsions, coma, and death. It's also used in chemical warfare. The theory is that Gloria had used DMSO regularly to treat pain from her cancer. When paramedics gave her oxygen, it could have triggered a chain reaction that turned the compound into a poisonous gas. And that gas was released into the ER when her blood was drawn or when she exhaled. It's a compelling theory, but no one has ever been able to prove it. There's no hard evidence, no clear chain of events. And officially, the case is still considered unresolved. That alone would be unsettling enough. But the deeper you go, the more disturbing the details become. For starters, many of the original medical records from that night, charts, blood test results, internal incident reports, were destroyed by the hospital. Burned, not archived. No explanation was ever given. Gloria's body was held for over 2 months before an autopsy was done, and by the time it was, her body had badly decomposed, making it impossible to test for many substances. The Ramirez family was denied the chance to see her one last time. They were kept in the dark, told little, and given no real closure. Even the trauma room where she died was sealed and scrubbed before any outside investigators could examine it. That in itself is a huge red flag. People began to speculate that the hospital was hiding something. Some said it was a simple screw-up, that someone had mishandled a chemical and didn't want to take the blame. Others believed it was something far bigger. Maybe Gloria had been unknowingly part of a government trial. Maybe she had been exposed to a classified compound. Maybe what happened in that room wasn't an accident. It was a side effect. There are even stranger theories that her body chemistry changed in ways we don't understand, that something parasitic or engineered was living inside her. Whatever the case, the core fact remains. Over 20 trained ER workers fell violently ill in minutes. Some were hospitalized. One nearly died, and not a single toxin, gas, or virus was ever found. No one touched her blood directly. No one was contaminated in the traditional sense. It was as if her presence alone was enough to poison the room. And that fact, what science can't explain, is what makes this one of the most chilling medical mysteries ever recorded. But it's not just the science that makes the story terrifying. It's the idea that someone could become dangerous simply by being alive, that a body in pain, trying to survive, could somehow turn into a biological threat. Gloria Ramirez wasn't a villain. She wasn't radioactive. She was a person fighting cancer, just trying to stay alive a little longer. She left behind 2 children. She was known as kind, funny, always smiling, even through the worst days. And yet when she arrived at that hospital, something inside her triggered a chain reaction that no one saw coming. Something that science still can't fully explain. Some people call her the toxic woman, but that label hides the deeper truth. Gloria wasn't the problem. The system failed her. The science failed her. And maybe if you believe in that kind of thing, something else was involved too. Something that science hasn't named yet. Because even now, nearly 3 decades later, no one can say exactly what happened that night in Riverside. No one can explain the ammonia smell, the floating crystals, or why healthy medical professionals fell one after another. No one knows what really poisoned the room, and maybe we never will.